Welcome to Transcend Awards. Prioritize infection awareness. Your learning objectives are to understand types of viral infection, to understand the cause, signs and symptoms, to understand the treatments and response required. Once you know these, you can take positive action to prevent viral infection or to mitigate the effects of an incident or outbreak. Infectious disease, infection pathogens. There are 5 main infectious agents, also known as pathogens, that invade the body and cause infectious disease in humans. These invaders are categorized as bacteria, viruses, fungi, prions, and parasites. We will now focus on viral infection, causes, signs, symptoms, treatment, and proactive response. Viral infections. Virus defined. Viruses are submicroscopic infectious agents that are only able to replicate inside the cells of a living host. Viruses can infect all types of life forms, from humans to animals, and plants to microorganisms such as bacteria and archaea. Viruses and their origins in the evolutionary history of life remains unclear. Some scientists believe they're pieces of DNA that can move between cells, while others believe that they may have evolved from bacteria. Breakthroughs in science and medicine have enabled us to identify the source of specific viruses. For example, the 2009 swine flu outbreak originated in Veracruz, Mexico. Health workers traced the virus to a pig farm in this southeastern Mexican state. A young boy who lived nearby was among the first people to contract the swine flu. More recently, with regards to the COVID-19 coronavirus, on the 31st of December 2019, the World Health Organization was informed of a cluster of cases of pneumonia with unknown cause detected in Wuhan City in China. Scientists continue to work hard to trace the exact origin, and the hypothesis is that the virus came from bats and passed through an intermediary animal infecting humans. Viruses defined. Viruses are small particles of genetic material, DNA or RNA, that are surrounded by a protein which invades our bodies and reproduces. Viruses can be positive or negative, dependent upon the nature of the virus. Viruses can positively help living organisms in certain circumstances by protecting them against other infections, supporting evolution through gene transfers. Viral infection causes. Viruses are hijackers. They invade living normal cells and use those cells to multiply and produce other viruses like themselves. Viruses are the most abundant of the infectious agents in the human body. A viral disease is any illness or health condition caused by a virus. Viruses and viral diseases are not always contagious, but many of them are. Common examples of contagious viral diseases include the flu, the common cold, HIV, and herpes. Contagious viruses can invade our bodies from a number of infected sources, including from person to person, from contaminated objects, and even insect bites. Contagious viral diseases can be transmitted in different ways dependent upon the nature of the disease. Contagious viral infections can be transmitted when a person does not even know they have symptoms. This can cause a pandemic like the recent coronavirus COVID-19. Viral infection scope. Viral infections are wide-ranging and can be categorized as respiratory viral diseases, gastrointestinal viral diseases, exanthematous viral diseases, hepatic viral diseases, cutaneous viral diseases, hemorrhagic viral diseases, neurologic viral diseases. Respiratory viral diseases. Description. Respiratory viral diseases are contagious and commonly affect the upper or lower parts of your respiratory tract. Common symptoms. Common symptoms of a respiratory viral disease include runny or blocked nose, coughing and sneezing, fever and body aches. Transmission. Respiratory viruses are spread by droplets generated through coughing or sneezing. If someone with a viral illness coughs or sneezes nearby and you inhale these droplets, you may develop the disease. These viruses can also be spread through contaminated objects such as doorknobs, tabletops, and personal items. If you touch one of these objects and then touch your nose or eyes, you could develop a disease. Respiratory viral diseases. Scope. Respiratory viral infections are common. Some are easily treated and others fatal. This list is not exhaustive. Flu, common cold, severe acute respiratory syndrome or SARS, parainfluenza virus infection, coronavirus including COVID-19. Treatment. Respiratory viral diseases usually heal on their own, but over-the-counter medications, including paracetamol, nasal decongestants, and cough suppressants, can help to reduce symptoms. Some respiratory viral diseases can be fatal, such as coronavirus. In these cases, some people may present light symptoms. Others may need ventilator support to help them breathe whilst their immune system fights the disease. The recent coronavirus is an example of how deadly and devastating and fatal a contagious respiratory disease can be, as there is no cure or vaccine. Prevention. The best way to avoid respiratory viral diseases is to wash your hands often, cover your mouth when you cough or sneeze, and limit interactions with people who show symptoms. There's also a vaccine that can help to reduce your risk of getting the seasonal flu. This cannot help with coronavirus, where you must stringently social distance and look after your immune system. Gastrointestinal diseases. Description. Gastrointestinal viral diseases affect your digestive tract. The viruses that cause them are contagious and usually lead to a condition called gastroenteritis, also called the stomach flu. Common symptoms. Common symptoms of gastrointestinal viral disease include abdominal cramps, diarrhea, and vomiting. Transmission. Gastrointestinal viruses are shed in the stool during bowel movements. Food or water that's been contaminated by feces can spread the virus to others. You can also be contaminated with the virus from sharing utensils or personal objects with someone who has a virus. Similar is someone coughs or sneezes nearby and you inhale these droplets. You may develop a gastrointestinal disease. Gastrointestinal viral diseases. Scope. Gastrointestinal viral infections are common. Some are easily treated and others fatal. This list is not exhaustive. Norovirus infection, rotavirus infection, some adenovirus infections, astrovirus infection. Treatment. There are known treatments for gastrointestinal viral diseases. In many cases, they resolve on their own within a day or two. It is essential to drink plenty of fluids to replace those lost from diarrhea or vomiting. Failure to replace fluids can lead to severe dehydration and can be fatal, especially for those with weak immune systems. Prevention. You can prevent gastrointestinal viral diseases by washing your hands often, especially after using the bathroom. Wiping down contaminated surfaces and not sharing personal items or eating utensils can also help. There is a vaccine for rotavirus that's recommended for children. Exanthematous diseases. Description. Exanthematous viruses cause skin rashes, but they can cause additional symptoms as well. Many of the viruses in this category, such as the measles virus, are highly contagious. Common symptoms. Common symptoms of exanthematous viral disease include skin rashes and spots, fever, head and body aches. Transmission. Many exanthematous viruses are spread through respiratory droplets from the cough or sneeze of someone with the virus. Other exanthematous viral diseases, such as chickenpox and smallpox, can be transmitted by coming into contact with fluid in broken skin lesions. Shingles only occurs in people who've had chickenpox at some point. It's a reactivation of the varicella zoster virus that's been lying dormant in your cells. Chikungunya virus is spread through a mosquito bite and cannot be transmitted from person to person. Exanthematous viral diseases. Scope. Exanthematous viral infections are common. Some are easily treated and others fatal. This list is not exhaustive. Measles, mumps and rubella, chickenpox and shingles, roseola, chikungunya virus infection, Fifth's disease, smallpox, which is now eradicated. Treatment. Treating exanthematous viral diseases focuses on managing symptoms. Fever-reducing medications such as acetaminophen can help with some of the more bothersome symptoms. Antiviral drugs such as acyclovir may be given for chickenpox or shingles. Measles, mumps and rubella are extremely contagious, can result in severe complications, permanent disability, and can be fatal in young children. More than 100,000 people die each year from measles, and most are under 5 years of age. Prevention. Measles, rubella, chickenpox, shingles and smallpox can all be prevented through vaccination. Failure to vaccinate can result in contracting the viruses. The risk of contracting chikungunya virus infection can be reduced through protection from mosquito bites. Hepatic diseases. Description. The hepatic viral diseases cause inflammation of the liver, known as viral hepatitis. Diseases caused by other viruses, such as yellow fever virus, can also affect the liver. Common symptoms. Common symptoms of a hepatic viral disease includes inflammation of liver tissue, yellow discoloration of the skin and whites of the eyes, tiredness, poor appetite, vomiting, abdominal pain, and diarrhea. Transmission. Hepatitis A and E are mainly spread by contaminated food and water. Hepatitis C is commonly spread through infected blood. For example, this may occur during needle sharing by intravenous drug users. Hepatitis B is mainly sexually transmitted, but may also be passed from mother to baby during pregnancy or childbirth and spread through infected blood. Hepatitis D can only infect people already infected with hepatitis B. Hepatic viral diseases. Scope. Hepatic viral diseases include hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. Treatment. Medications may be used to treat chronic viral hepatitis. Antiviral medications are recommended for all with chronic hepatitis C, except those with conditions that limit their life expectancy. A liver transplant may be an option in both acute and chronic liver failure. Hepatitis is a very serious disease and causes millions of deaths worldwide each year. Prevention. Hepatitis A, B, and D are preventable with immunization. It is very important to take extreme care when managing needles and caring for those with an open wound. Cutaneous viral diseases. Description. Cutaneous viral diseases cause lesions or papules to form on the skin. In many cases, these lesions can stay for a long time or come back after disappearing for a while. Common symptoms. Common symptoms of cutaneous viral disease includes lumps and blisters on skin that may break open, enlarged lymph nodes, patches of skin that may be raised or scaly and might be itchy. Transmission. Transmission generally occurs through direct contact with others who are infected. Viruses get into your body through your mucous membranes. Your mucous membranes are the thin layer of tissue that line the openings of your body. They can be found in your nose, mouth, and genitals. Cutaneous viral diseases. Scope. Cutaneous viral diseases include genital herpes, oral herpes, warts, genital warts. Treatment. There's no cure for genital herpes, but the condition can be managed with medication. The disease stays dormant within your body until something triggers an outbreak. Outbreaks can happen when you become stressed, sick, or tired. Babies who are born with genital herpes can develop very severe complications and need immediate medical attention, as this can cause blindness and can be fatal. Pregnant women must inform a doctor to enable precautions to be taken. Warts can go away on their own or can be treated with freezing methods. Medical attention should be sought for those with other illnesses such as diabetes, and also if the warts are painful and change colour. Prevention. Safe sex is essential, as is stringent hygiene practices. Hemorrhagic viral diseases. Description. Hemorrhagic viral diseases are severe conditions that involve damage to your circulatory system. Common symptoms. Common symptoms of hemorrhagic viral disease includes high fever, weakness and body aches, bleeding under the skin, from the mouth or ears, and in the internal organs. Transmission. Some hemorrhagic viral diseases, such as dengue fever and yellow fever, are spread through the bite of an infected insect. Others, such as Ebola, are spread to other people through contact with the blood or other bodily fluid of someone with the virus. Lassa fever is spread through inhaling or consuming the dried feces or urine of a rodent with the virus. Hemorrhagic viral diseases. Scope. Hemorrhagic viral diseases include, but are not exhaustive, Ebola, yellow fever, dengue fever, Lassa fever. Treatment. There's no specific treatment for hemorrhagic viral diseases. It's important to stay hydrated, and some people may need intravenous fluids to maintain electrolyte balance. Supportive care to maintain hydration and electrolyte balance is essential. In some cases, the antiviral drug ribavirin may be given. You must seek medical attention as fatalities can occur. Prevention. A yellow fever vaccine is currently available, and if you live or work in an area where viral hemorrhagic diseases are common, you can do the following to reduce your risk. Use proper protection, such as gloves, glasses, or a face shield when working around people who have the virus. Avoid being bitten by insects, especially mosquitoes and ticks, by wearing protective clothing or using insect repellent. Protect against rodent infestation by keeping food covered, removing garbage often, and making sure windows and doors are secured properly. Neurologic viral diseases. Description. Viruses can infect the brain and surrounding tissues, causing neurologic viral diseases. These are very serious diseases. Common symptoms. Common symptoms of neurologic viral disease includes fever, confusion and drowsiness, seizures and coordination problems. Transmission. Not all viral infections are communicable between people. However, for those where transmission occurs, this is dependent upon the nature of the virus. Common transmission of infectious diseases includes direct contact with other people, transmission through droplets, contaminated water, objects, food, and fecal-oral transmissions. Neurologic viral diseases. Scope. Neurologic viral diseases include polio, viral meningitis, which is the most common type of meningitis, viral encephalitis, rabies. Treatment. Viral meningitis is the most common type and is an inflammation of the lining of the brain and spinal cord. It is often less severe than bacterial meningitis, as people tend to get better on their own. A doctor should still be contacted right away, as it can turn serious. Polio is highly contagious and in its most severe form causes nerve injury leading to paralysis, difficulty breathing, and sometimes death. Not everyone will experience symptoms who contract the virus, but medical attention must be sought. Rabies is generally not found in the UK, except in a small number of wild bats. It is almost always fatal once symptoms appear, but treatment through injections can be very effective soon after a bite occurs. Encephalitis needs urgent treatment in hospital. Depending on the cause, treatment may include antiviral medicines, steroids, or antibiotics. Prevention. Vaccination is available for those at risk of rabies infection and polio. Some of the infections that cause encephalitis can be prevented with vaccines, such as the MMR. Viral infection treatment. For most viral infections, treatments can only help with symptoms while you wait for your immune system to fight off the virus. Vaccines can help prevent many viral diseases, and this must be promoted. Antibiotics do not work for viral infections, although there are some antiviral medicines to manage the symptoms. If you or anyone in your care presents signs or symptoms of serious and contagious viral infection, you must seek immediate medical attention, initiate rigorous hygiene measures, and, in many cases, you practice social distancing techniques. The best way to treat viral infection is to prevent through vaccination, practice excellent hygiene, work on your personal well-being, and impose stringent social distancing where this is needed. Bacterial infection response. Seek medical attention when you feel ill or if you recognize signs of serious viral infections in those in your care. The best way to do this is keep others away from the infected person to prevent the spread. Call 111 to seek medical advice and treatment, giving a clear account of the symptoms so that healthcare workers can take precautions to prevent the spread of the infectious disease. Bacterial infection response. Do not delay. Stay alert. Save lives. Thank you for watching. Feel free to watch as many times as you need. We'll move on to the next part of your digital learning experience on your list.